see our emails. So definitely reach out to us if you have interest in community doula work or community doula trainings across the state. Next slide.
Sorry, it should be moving.
Okay.
There you go.
So a lot of people want to understand more about what defines community-based doula. And we love to explain and take apart the 3 words. I am going to allow y'all to read the community and the based and the doula, because a lot of people have heard the doula definition. And so we want to set apart to say that community-based doulas are trained peer, well-versed in the community that they serve, and they provide the physical, the emotional, and the educational support in a very culturally sensitive way. And what that, means is we like to hire and train those that have lived experience of who they will be serving. And doulas are non-medical, so non-clinical, and we work with the team, the medical team, and we want to empower families before they arrive to the birth and are well prepared and are, they're an informed consumer about their birth. So you can go to the next slide. So we're going to hold off on the film and see if we have the 4 minutes. We'll come back to that. But that gives you, you get to hear from those that have been served in the video. So some people want to understand the difference between more of the independent doula workforce and community-based doulas. And independent doulas, they may own their own practice and have it as a business model. They may provide culturally congruent care, but they may not. That isn't usually a part of their values. And sometimes they may not connect with resources. So that's a big piece to our model, is ensuring that social determinants of health are discussed and actually connected to resources in the community to ensure better outcomes. Often independent doulas are seen as a luxury, and they have fees associated with their services. And I and Amber both believe doulas deserve to be paid. So we like to say independent and community-based doulas, everyone needs to be paid. It's just a different finance model. For community-based doulas, typically they're working within an organization and they are trained and they are well-versed in providing culturally congruent care. And that means they know about all the local community resources and the intensity or the dosage, as we call it, with Birth Matters and others that we have trained across the state. It really is about high touch and high encounters on the prenatal side and the birth side and the postpartum side. So Birth Matters model is early in prenatal. As early as we get a referral, we go ahead and start serving. And then we cut off if they're 25 weeks. We make some special exceptions, but for the most part, because we replicate Health Connect One's model, we are not able to take them really far along in pregnancy and gestation. So, and then we often, we're on call, and doulas take call very serious. And then postpartum, we follow them until the baby turns 1, because we track infant mortality. So, and the last piece on the slide just says that, the community doulas are from the same community that they're serving. This is another way to say a lot of the stuff that I've already mentioned, meaning the pay source, and how we work in medical settings beside medical staff. And we do want to make sure we're always removing barriers. And one of the gifts and one of the special pieces to being a doula is really understanding how to hold space and allow people that they're serving to have that time to create voice and find voice. And that isn't always easy for home visitors in particular. But when you are trusted and from the community, you get to that space sooner when you're of the community that you're serving. Right here, it says community-based doula services are long-term, early in pregnancy, and then continue 6 months. And our model is a year. So again, we're wanting to say what we know in South Carolina is the 6 month is the norm. And then some programs will extend out. Next slide. So this is so true. And we didn't put our slide on our staff slide, but all of our doulas that are trained and hired and working with Birth Matters identify as Black. And we are currently serving Birth Matters, and Spartanburg is currently serving Spartanburg County and Cherokee County, and we're growing to Union County in the coming months. And so a big piece to this model for Birth Matters, and my position in particular, is to ensure that we are training more community doulas all across the state. So we will be workforce ready. We anticipate and are hopeful that policy direction will be in alignment with the 12 other states that have gone before us and have received Medicaid reimbursement particular to doula services. So we want to prepare for that, and we want to be ready and have doulas, community doulas, serving across all counties really is the goal. So the quote here is, doctors are the experts on medicine, and we tell our families that they need to own being the expert of their own body and finding that voice of how to explain to providers and nurses what's going on. So that's a big component. So the why of Birth Matters, I would assume everybody on this call knows that we have not been doing real well. And the infant mortality and mothers dying and pregnancy related or birth related complications. And then, we know that when babies are born low birth weight or too early, it sets them up for a disadvantage for the rest of their life. And so we want to acknowledge that Birth Matters has made a strategy to serve the Black and Brown community across the state, and in hopes that we will see some improvement in these outcomes. And there's evidence. The next slide is going to show you particular to Birth Matters results. And a lot of the research, there's national evidence regarding why doulas, why now. And that's the stuff at the top that just says, there's the evidence that says fewer cesareans, fewer NICU, more breastfeeding. And that's not just at birth, that's at 6 months and the first year of life. We know that our results are, we haven't had we haven't lost any babies or mamas since our inception, which we go back 15 years plus now. We started out as a program of Regenesis, which is a federally qualified health center, and then we became our own nonprofit and started taking outcomes a lot more serious once we got our nonprofit status. So this is to spotlight, how many families we serve in 2 years. This is 188 families were served. High numbers of Black American, 83% breastfeeding at birth. And I was able to find the African American South Carolina statistics is 75. And depending on what community you live in, it's a lot lower in some communities. And then we have 14% low birth weight. Again, that is about in alignment with state and national numbers. It's just that we are serving those families that have high risk, complicated health conditions walking into birth or walking into pregnancy. And we were 30% C-section compared to 33 average for South Carolina. And I know those numbers aren't huge, but they are huge difference in numbers. And that's why we wanted to show that we did a return on investment with the Center for Community Health Alignment. And we were able to prove that we saved, for every dollar invested, we saved $2.12. So that was a long-term 4-year study with lots of families, and we were able to prove by numbers how much we're saving. So if we have time for the video, we can go to that if we need to. Yeah, we love people to follow us. You will learn a lot about the statewide trainings if you subscribe to either our newsletter or that you can sign up through the website or follow us on really Instagram and Facebook is our primary social media handles. And we do a little bit on Twitter here and there. And I know it's not even called Twitter anymore, X. But anyway, do we have time for the video or do we want to go for the?
We sure do.
Okay.
So give me a moment, and I'm gonna go back to that slide. Let me know when I hit it. This is it.
Yes.
And I just click here on the photo.
Hopefully.
Yes.
Okay. Let's take a look. And I'll expand it. Let me know if you can see this or cannot see this. Can you see it?
We don't see the video.
Okay, give me 1 second.
You might want to,
Yeah,
I know
I'm gonna stop sharing and then reshare. So give me 1 second.
Sure.
Can you see this now?
Yes.
Wonderful. Okay. And here we go. Let me know if you hear it as well. Yes, there we go.
I don't think we can hear it.
Can you hear it?
No,
Mm.
it's okay. Because it's okay. The other thing, I mean, it's just, we can send it an email or, you know.
This is what will happen. 1 second.